Doctors have criticised the Victorian government for not funding enough new hospital beds. Only 2 of the 19 beds at the new Monash Children's Ward will be available when the ward opens next month. The government says it is meeting demand, but as Margaret Paul reports, doctors disagree.
This is meant to be a children's ward, but there aren't any children, and doctors say it isn't because of a lack of demand for beds.
There's no doubt that the reason why we need those beds now is because the demand is there, but the funding isn't.
These pictures were taken by a hospital insider. Southern Health admits only 2 beds at Monash will be available when the 19-bed ward opens next month. And as few as 6 cots are being used at Casey Hospital's children's facility out of a possible 20.
I'm confident that Southern Health and the clinicians at Southern Health will open beds as required, that they will have capacity that's available and that will provide good care.
But the AMA says Southern Health is having to send sick children to other hospitals for treatment.
My members are telling me that they need the resourcing there to be able to do it. They can't open the beds otherwise.
This government has promised additional beds, promised additional 100 beds, and what it didn't perhaps appreciate is that those beds only make sense and they only deliver a service if there's enough doctors and nurses to support those services.
The government says the remaining children's beds will be opened over the next 2 years. Margaret Paul, ABC News, Melbourne.